Hello. If you have a soft tissue swelling under your skin and someone told you it's a lipoma, you may be confused and worried. Some people tell you to ignore it and others scare you and say that it must be removed immediately. In this video, I will clearly explain when a lipoma removal is actually needed and when it is perfectly safe to leave it alone. My name is Dr. Devish. I'm a plastic surgeon practicing in Bangalore. I see patients with lipoma almost every day, and in most cases, the anxiety caused by the swelling is far greater than the actual medical problem. A lipoma is basically a benign growth of fat cells that forms just below the skin. It usually feels soft, smooth, and it's movable when you touch it. Lipomas grow slowly over the time and commonly are found in the neck, the shoulders, the back, arms, thighs, or sometimes even over the tummy. The most important thing to understand is that lipomas are not cancer. Even though lipomas are harmless, the word lump immediately creates a fear. So patients often come to me reading information online, which unfortunately increases their anxiety instead of clarifying it. Medical decisions should never be made based on these fears or internet searches. Let me be very clear about this. Most lipomas do not need surgery, especially if they are small, painless, growing very slowly, not causing any cosmetic concern, or not affecting movement. In those cases, observation is completely acceptable. There is no medical urgency to remove such a lipoma. So there are certain situations where removing a lipoma makes sense. Removal is usually recommended when the lipoma is increasing in size, it is causing pain or discomfort, restricts the movement, or causes any cosmetic distress, or if there is any doubt about the diagnosis. In these cases, removal is done not out of fear, but for comfort, clarity, and a peace of mind. Lipoma removal is usually a minor surgical procedure, and in most cases it is done under local anesthesia. So we make a small incision on the swelling and the lipoma is removed along with its capsule and closed using stitches. Most commonly we use self-dissolving stitches, and most patients go home the same day. Recovery after lipoma removal is generally straightforward, and there may be some mild discomfort for a few days, which is usually controlled with simple pain medications. Most patients would return to their normal activities quickly. However, recovery may vary depending upon the size and location of the lipoma. So one common mistake patients make is ignoring a lipoma for many years out of fear. Another mistake is rushing through its removal without any proper examination, and both extremes are unnecessary. So the correct approach is a balanced medical evaluation. So if you have a swelling and are unsure whether it needs treatment, the safest first step is a proper clinical examination. And if you are in Bangalore, consult a qualified plastic surgeon for accurate guidance. My clinic details are mentioned in the description below.